I'm Dr. Flash. I'm your HIV doc. I love my job. I'm a physician scientist. I started and run one of the oldest HIV prevention programs in the country. I'm here to answer your questions. So often, patients wait for the doctor to do things. If you want to make sure that you've been tested, ask for the test. You do your part and I do my part. I'm gonna walk with you, don't be scared. PrEP is a game changer. For the first time, you have something that is completely woman-controlled, and that is empowering. Our goal then is to drive that viral load down as low as we can. When it is as low as it can get, that's called undetectable. People 20 years ago would say, I was crazy to say, I want to end AIDS. But that time is here. You can become infected and not have real symptoms that would trigger a thought, oh, I should go get tested for years and years and years until you do. Until the virus has quietly been attacking your immune system and you hit that threshold where your immune system is weak enough where all of a sudden you're sick all the time. I want to catch people early when they have no symptoms, they had no idea, because when we start treatment on people early, they have longer lives, they do better, and they don't have all of this inflammation in their bodies from just having virus there replicating itself and damaging their systems. They do much better. So often patients wait for the doctor to do things, or, well, the doctor had a lot of blood drawn, so they must have been checking everything. Unfortunately, although the recommendation is for all adults to get tested for HIV, not every doctor is doing that for every patient. So if you want to make sure that you've been tested, ask for the test. I think of myself as a regular person too. I'm working, I'm married, I'm just having a regular life, but I tell my own clinician, I want you to test me for HIV, gonorrhea, chlamydia, syphilis, check my blood sugar, check my cholesterol. I want to know that all systems are go, and I would like you to do that once a year. And that's not making a judgment about my husband or my lifestyle or whatever else is going on. It's just about security and knowing what's going on with my body. Some people will test with an oral swab. So they just swab the inside of your mouth and you'll get a result within 20 minutes that says whether you're HIV positive or HIV negative. Some places offer a test where they just do a finger prick and use 1 drop of your blood and they can give you an answer within 20 minutes. If you're someone who's scared of needles and you want to get your HIV test, being scared of needles is not a reason to not get tested. No. An HIV test is a blood test, and so a pap smear will not tell you that you have HIV. Oh no, absolutely not. Common contacts like holding hands, hugging, kissing, sharing a glass, sharing a plate, sharing a bathroom, there is 0 risk of transmission. PrEP is really effective. As with anything else, how well it works depends on you. So for example, if you have high blood pressure and you take your blood pressure medication only half the time, it's only gonna work half the time. And half the time your blood pressure is gonna be higher than you want it to be. So just like with anything else, if you take it on a regular basis, it will provide that protection for you. I want you to think about building a wall of protection. Each of these blue pills, like a blue brick, we're building a blue wall to protect ourselves from HIV. So if I lay down 1 brick, do I have a wall? With this medication, you need to take it on an ongoing basis. So 1 day is 1 brick, 2nd brick, 3rd brick. Do you see your wall is getting built? And I skip a brick. And then I lay a brick and I lay a brick and I skip another brick and another brick. What happens to your wall? You don't have to be an architect for me to say that that wall is not as strong. If you're having anal sex, you need 7 bricks to create that wall of protection. If you're having vaginal sex, you actually need 21 days of protection. So that's why taking this on a daily basis is so important, because you want to maintain a really strong wall of protection. yes, you can stop and start as long as you understand how to do it safely. But if you're on it, my recommendation is if you're on it, let's be on it until you're ready to stop, and then let's stop. And if things change and you need to be on it again, let's get on it again. But let's make sure that you're safe and that you don't have a false sense of protection. Everything has a good side and a bad side, even Tylenol. PrEP is no different. The most common thing that people can experience when you first start taking the medication, your body knows something new is going on. And you have a little upset stomach, a little nausea, you just feel queasy. It's not everyone. It's probably 1 to 2% of people experience this, but generally after the first few days, that passes. There are some people who have noticed headaches when they start the medication as well. Again, usually those headaches are resolved by over-the-counter medications like Tylenol or Motrin. So that's the most common thing that happens. It doesn't happen to everyone, but I want you to be aware of it because I don't just want you to stop. Because usually if you can power through and take it consistently, that goes away. Any doctor can prescribe it to you. They don't need to be a specialist or an infectious disease provider or an HIV specialist. Even a family doctor, an internist, or an obstetrician, someone in your community clinic can prescribe PrEP for you. Some people encounter the experience where their doctor doesn't really know a lot about it. So sometimes you have to encourage your prescriber to actually get more information so that they can feel comfortable providing it for you. Most insurances cover the medication. It really depends on how good your insurance is in terms of how much of a copay you pay. There are resources available that offer copay assistance to even cover that for those patients. So for the most part, patients that are insured are able to access PrEP through their insurance. There are medication assistance programs that even for patients that don't have insurance that allow coverage of the medication. Most patients will pay little or nothing to get access to PrEP. So I'll tell you what happens if you come to me. At that first visit, we'll do an HIV test, we'll screen for other sexually transmitted infections, and we'll check your kidney function. And then you'll get your prescription. I see patients about a month after they start the medication to make sure everything is going well, to make sure you're tolerating it, that you don't have any additional questions, just a quick check-in visit. But then I see patients every 3 months. I make sure that we get HIV testing at that time. Those are quick visits. At each visit, you have the opportunity to talk with someone in the clinic about any challenges you're having with adherence, any questions you have. That's it, simple, easy. I have to tell you, it's a great question. If you are using condoms reliably, if you're really using condoms every time for 100% of the encounters, potentially you don't need anything else. I'm not there with you, and I can't tell you what you're really doing. I can't tell you if you're the person who, when the lights are low and the music is slow, you're halfway done and then say, oh my God, where's the condom? That's not really using the condom 100% of the time. What I'm offering you is not a cure-all, but an additional tool in your toolkit of protection. PrEP protects people from HIV. Part of the reason that when I counsel people about PrEP, I also talk about condoms is because HIV is not the only thing that's out there. PrEP will not protect you from gonorrhea or chlamydia or syphilis or an unplanned pregnancy. So condoms are important to protect you from these other things. If you miss a dose, don't panic. Just go ahead and take it the next day. If you miss multiple doses, go ahead and take your next dose is regularly scheduled, but I want you to be thoughtful about it. I want you to not just say, oh, well, I missed 2 doses, I can move on. I want you to make sure that if you start missing multiple doses during any given week, that for those coming days, that you make sure that you're using condoms or that you're being really thoughtful about what exposures you're having so that you make sure that you're protected. We have years of data of using this medication for women that are pregnant, and we know that they're safe, that their babies are safe. And now we have more and more experience with using PrEP for women that want to get pregnant. We prescribe to women who want to make sure that they don't get HIV and that their babies don't get HIV. Though their partner is HIV positive, we do use PrEP in that way. If if you're on estrogen therapy or you're on testosterone therapy, those things should work well and shouldn't affect how well the medication works. You want to make sure that your doctor knows what other medications you're on. That's part of the reason why I think that it's important to have a prescriber to walk with you through this, where you can kind of go through the risks and benefits, not just the theoretical risks and benefits on the back of the package label, but what's actually going on in your life with your health, your medical challenges, your medications, and your lifestyle. Yes, you can take your birth control and you can take PrEP, and it's safe. What I would tell a prescriber who's thinking about offering PrEP to their clients is that it's really not that complicated. The first thing is you want to make sure that you're actually assessing patients and offering it to vulnerable patients. This is not for the worried well, right? You want to make sure that you're offering it to vulnerable patients. And you also want to make sure that the person doesn't already have HIV. So you want to do that HIV test first. Other than that, it's really, really simple. You check a couple of safety labs, you check their kidney function, you check if they've had HIV, you check their hepatitis status, you prescribe, you follow up with them in a couple of weeks and make sure that everything is going smoothly. You make sure to see them every 3 months. This will become the easiest patient in your practice. Many of the patients that I prescribe to that are on PrEP are young, healthy people who really have not much else going on. So in terms of things you can bill for that are really simple, it doesn't get much more simple than this. That's an excellent question. So undetectable doesn't mean that you're cured. It just means that the virus is completely controlled. It's hard to explain without understanding what a viral load is. When we are taking care of someone who has HIV, there are 2 numbers we think about, and one of them is called the viral load. What that is in each drop of blood, how much virus is actually there. The more copies of virus someone has in each drop of blood, often the sicker they are, but also the easier it is for them to transmit virus to somebody else. So our goal then is to drive that viral load down as low as we can. When it is as low as it can get or below the level at which we can detect it, that's called undetectable. HIV is this kind of sneaky virus and it hides out in your body. And if you stop taking your medications, those viral particles that are hiding out start to reproduce themselves and make more, and then your viral load goes up. So if you're on a regimen and you're kind of taking it on again, off again, and you weren't as adherent as you really want to be to have things well controlled, over time it can stop working for you. Someone can say, well, I've been on my medication for years. I'm sure I'm undetectable, but I haven't been to the doctor in years to really check. I want to know that you've actually been evaluated and we know that that's an undetectable level and those medications that you're on are actually working well for you. An HIV test and a viral load are 2 separate things. If someone wants to figure out whether or not they are infected with HIV, they get an HIV test. If someone wants to know how well controlled the virus is, they get a viral load. The tests that are used nowadays to evaluate HIV are looking for your body's response to the virus. They're looking for those proteins. They're not actually evaluating generally a load of virus in the blood. We don't have people ever practice the words, and then when the lights are low and the music is slow, we wonder why the conversation doesn't happen. So talk to the person. Ask them about themselves and their health. Ask them about condom use. Ask them if they had an STD and have they been treated. Have these conversations. I'm not telling you to ask your partners if they've ever been tested because I want to make your relationship more challenging. I want you to make your relationship more close. And so you want the kind of relationship or the kind of interaction where you can talk freely about each other's lives because you're about to do the most intimate thing on earth. Let me put it like this. Putting your risk of getting HIV in the hands of whether in the moment he is going to pull out before there is any preliminary fluid or before he actually completes is not an adequate HIV prevention approach. Absolutely. Absolutely. You know, that is probably one of the earliest victories in the HIV epidemic, was this ability to realize that women who were infected with HIV could actually safely have children. Now, they can't just go out into the world and make a baby. They need to have their virus well controlled. So ideally, they're on medication, their viral load is undetectable and well controlled. When they get to the point of delivery, during delivery, medication is administered as well. And then after the baby is born, the baby gets medication also for several weeks to make sure that they do not become infected. In the United States, as quiet as it's kept, 1 in 5 HIV infections actually occurs amongst women. And the majority of those women are Black women who are infected with HIV. What the data shows is that when you compare Black women and white women who are infected with HIV, the Black women who become infected with HIV actually have fewer sexual partners, are more likely to use condoms, and yet are more likely to become infected with HIV because there's more HIV in the communities in which they're having sex. Nobody wants to be a statistic, right? You want to be a person. If you're in a community where there's a lot of HIV and you don't know it, the chances of you getting it are higher. If we keep thinking of HIV as something that only happens in those communities, then we won't get tested, because you'll say, oh, that's not me. I don't fit that bill. I'm not that person, so I don't need to get tested. Not because you didn't make all the right choices, but because you allowed the story to stop you from getting tested. PrEP is a game changer because for the first time, you have something that is completely woman-controlled. I mean, he doesn't even have to know. She can take control of her own sexual life and her own sexual health, and that is empowering. That is one of the few spaces in life where women have complete control of what's happening. There's so many spaces for women where we lack power and lack control, even when we think we have it. So in so many spaces in our lives as women, and particularly as Black women, power was taken away from us despite our best efforts. And so PrEP is one of the few areas where you have complete control. And that's why I encourage women to not wait for your often male doctor to offer PrEP to you if you think that it's something that you need because you're vulnerable. This is something that you can control. We absolutely can. You know, we are in a really phenomenal time in the HIV epidemic now, where people 20 years ago would say, I was crazy to say, I want to end AIDS. But that time is here. You know, you can look off into the horizon and see these biomedical interventions where you can put someone on 1 pill once a day to protect them from ever becoming infected, where you can drive down the amount of virus in people's bodies and communities so that they're able to engage with people safely. There's just so much that we can do now to prevent people from ever becoming infected, and even for those who are infected, have them have healthy and wonderful, well-engaged lives, that I think that the end is near.